90% of pediatric activity is down. 90% of anything pediatric is gone because they're all staying at home. My name is Dr. Inderpal Randhawa. I'm the founder and chief executive officer of the Translational Pulmonary and Immunology Research Center and the Southern California Food Allergy Institute. I'd like to take a minute to talk to you about our organizational recovery model. So the recovery of our organization is focused on two major aspects. One is to make sure that our employees and all the infrastructure in our organization are ready to go in a COVID-free zone all the time to make sure that it is the safest environment possible for both employees and for patients. And we've proudly done that on a day-by-day basis now for the better part of 5 months. And the second aspect of it is to make sure that our current patients are most taken care of first, while we actively grow the rest of the organization, again, during a very unique state of recovery that is not being seen in the rest of the medical field. In this current pandemic, food anaphylaxis has once again been put into a position where it is no longer a top priority. The FDA has relaxed the labeling restrictions towards food products, which now poses a significant risk to children. If you look at the major drug companies, when it comes to epinephrine injectors suddenly can have prolonged expiration dates, which we don't even know if that's incredibly accurate as it stands. Clinical trials are pretty much at a full stop. For the next 1 to 2 years, unless you're studying coronavirus, there's not going to be any clinical trials available. And in the end, we are in a position where, once again, the rest of the medical environment has told food allergy patients that you're just not so important. Well, I look at it from a totally different standpoint. For the better part of 15 years, I've dedicated my time, my life's work towards this condition, now ending in over 10,000 patients in active treatment. I knew many months ago that this condition would be a very serious threat to our form of immunological therapy and tolerance induction for our patients, and I took every effort possible to make sure that every one of those patients was able to continue as long as they are able to find a way to physically get to our institution. So for those of you who are on the wait list, you may be asking, will you get me into this program? And the answer is yes, we'll do everything possible to open up this wait list to accept hundreds of new patients per month in the very near future. We have actually put in significant dollars towards our infrastructure build, both at a software level as well as a physical structural level, to accommodate as many patients as possible, because even in the pandemic time, we're in a situation where those children are still at risk of fatal anaphylaxis. And for those of you who are in the program, are we going to continue to give you the utmost best level of care with even better 24/7 support? The answer there again is yes. We are not here just for the next 6 months, or we are not a month-to-month company. We are a company that's actually growing during a pandemic. So our organizational recovery is an example of what can happen even during the worst of times. And I hope that notion is taken by our patients as well, to take advantage of even very difficult times to give the best outcomes for our kids.